Name check. Okay.
Okay. Hi Joe, my name's Carrie Sue. I'm going to be your student nurse today. I'm going to close this curtain for privacy and do hand hygiene. Can I get your name and date of birth?
Joe Smith, 105-2003.
And that looks good for your wristband. Do you have any allergies, Joe?
Nope.
Okay, because our provider wants us to do a dressing change today and labs here, so we're going to get some labs. Is that okay with you?
Yep.
Okay, good. And you don't have any allergies?
Nope.
Okay, and you've never reacted to chlorhexidine or anything like that?
Nope.
All right, so I'm going to wash your hands again. And the first thing I'm going to do is set up my heparin, and then if he had a line going, I would make sure to disconnect that and wait 2 minutes or per policy. But he doesn't have any lines, so we're not going to worry about that. Okay. And due to training purposes, my boat's already open, but this would be sterile. And I'm going to verify my heparin to the order. Looks good. I'm going to make sure that's ready, and then I would open this. Make sure maintain sterility. Open the boat here. Connect my heparin. All right, switch it over. Make sure that's ready. All right, I'm gonna leave that there, remaining sterile. Okay, and now we can clean our site, Joe, with our salines. Get our blood. Okay. And this is, I'm gonna clean this for 1 minute. This is the lumen I'm gonna use to aspirate blood. Okay, 1 minute. And then I got my first flush here. Main sterility. Push, pause, push, pause, push, pause. Okay, and then I would aspirate 10 mLs, and it's patent. And I would undo the clamp if there was a clamp, and then I would close the clamp. Here's a lab. Now, how many do you need, lab?
7 mLs.
Okay, so I'm gonna hook this back up. I would open the clamp if there's a clamp, and I would aspirate my 7 mLs of blood. Hand that off. Okay, and then I'm going to do my last flush here. Open my clamp. Push, pause, push, pause. Okay, and I'm going to close my clamp, and I'm going to take off the entire cap this time. Set that aside. Now I got my new cap with my heparin, remaining sterility. I'm going to remove this cap. Open my clamp. And then I'm going to give my heparin push pause just to make sure there's no clots. And I'm going to close my clamp. And we are done with that. So now, Joe, I'm going to get everything set up for our dressing change. I'm going to clean my table, make sure all this is not there. Do hand hygiene. And during this procedure, Joe, I'm going to put a mask on you. I'm going to ask you that you keep your head turned away. Okay. Do hand hygiene again. And for purposes of training, again, this is open. But I'm going to carefully take out my gloves without breaking sterility and my mask. Okay. I'm gonna put my mask on now, Joe. Hand hygiene. Put my gloves on. And we are going to take off this dressing. And I'm not actually going to take off the dressing, but this is where I would take off my dressing. I would note for any signs of infection or anything like that, phlebitis. And do you have any pain, Joe?
Nope.
Perfect. So I took that off. I discarded my dressing. So now the dressing is off. I'm going to do hand hygiene again. Now I'm going to open up my sterile fields. Knitting in the 1-inch border. And I'm going to put my sterile gloves on. Okay, now that I got that, I'm gonna put my sterile gloves on. That one's on. Now I can mess around with my stuff. I'm gonna make sure I have my dressing, and I have this. And I am going to wash for a whole minute around thoroughly. Well, sorry, back up a little bit. I'm going to sacrifice this hand. And then I'm going to, because I'm right-handed, and then I'm going to thoroughly wash for 1 minute and up. Now this is no longer sterile, so I'm just going to drop that over there. And then I'm going to get my dressing, and I'm going to carefully rip that off. And then I would use this hand to rip this off, because I want to keep everything here sterile. And then I would put this on my site. And then I'm done.